Hi, everyone, and welcome. I am Kathy Hebler. I am one of the co-directors of the DAISY Center, and I am welcoming you on behalf of the DAISY Center and ECTA. We are co-sponsoring this webinar. We are very happy that you could join us today to hear about using IDEA Part C and 619 data with your PDG needs assessment. Just to review briefly kind of what we're going to try and do with you today. The purpose of this is to share information about the IDEA Part C, Part B 619 data. We're going to be highlighting some data types that are collected and where that data is located. And we are very excited to have some state presenters with us today who are going to be sharing state examples about use of the data and about analyzing the data for decision making. And all of that is in the hope of helping all of you understand how your Part C and Part B 619 data can be useful in the PDG context for your needs assessment and informing your strategic planning. With that, I'm going to turn it over to Grace Kelly.
Good afternoon, everybody. We're really glad that you could join us today. What we have put together for your information, as Kathy mentioned, is information about the data that is collected for IDEA. And we have some really great state examples. And we also have several state examples. We have a PDG grant manager who will be sharing information about how they have used data, integrated IDEA data with home visiting data. And can you all hear that feedback? Maybe people need to be muted. If you don't mind muting if you're not asking a question. We also have a presenter. We also have a data manager who manages both Part C and 619 data, Ginger, who will be joining us. And we have Jackie, who is a Part C coordinator, who can talk about her role within PDG and in helping with the needs assessment. So we'll go ahead and get started and give you some information about the types of data that are collected. For IDEA, Part C contains reporting requirements that for eligible infants and toddlers with disabilities aged birth to 3 and their families. And so every year, each state is required to submit a report on performance, a performance report on key indicators. There are 10 indicators that are collected on a yearly basis. And there is one indicator that is called the State Systemic Improvement Plan, which is a plan, a 5-year plan that has been developed by the states to address specifically a child or family outcome. So we'll talk a little bit more about that in depth at the end of the webinar. Part B is required to submit data for ages 3 through 21. There are several of those indicators that are very specific to children who are 3 to 5, which is the age range that we're working with in PDG. So there are a total of 14 indicators. They also have a state systemic improvement plan, but we'll be talking specifically about those indicators related on 3 to 5. So in looking at the data, as we've indicated, there's a lot of data that Part C, the IDEA Part C and Part B 619 collect that is beyond the federal data that's required to be reported. So we are going to share examples of that as well. And of course, that is a little bit different state by state, but we're going to give you some examples about that. And specifically, each state is required to submit data on these indicators. And as we looked at the PDG needs assessment and the upcoming strategic plan, we identified that this is the type of data that might be helpful in the work that you have. So one is child count. So there are states collect data on children birth to 1 and also birth to 3. There is also a % of birth to 3 served at the state and national level, and that data is available by race and ethnicity, but also by race and settings. And we have an example of that to share you in just a second. Another key indicator is related to child outcomes. So we're also collecting data around looking at the outcomes for children that's focused on three primary outcomes: positive social emotional skills, the acquisition and use of knowledge and skills, and use of appropriate behavior to meet your needs. Additionally, we also have family outcome data, and this looks at the percentage of families who know their rights, who are able to communicate their child's needs, and are able to help their child develop and learn. Additionally, we also have information on the percent of infants and toddlers primarily served at their home or in the community. So what are the settings, where are the places that infants and toddlers are served? I have several slides that are examples of data, and then Jackie is going to share an example of what this has looked like in her state. So first, one thing to note, I think specifically for Part C, is that while there is data collected, it's called child count data, is collected once a year on a specific date to identify how many children are served in the program. However, children are served throughout the year, and this slide represents a hypothetical state, but it shows the number of children by race or ethnicity across the state. So this is the total number of children served for a year. That number may look different than a specific child count data. Another question that's been asked is what percentage of children referred are enrolled in EI services? And what that might look like is something like this, that looking at percentage of children from referral to transition. So the percentage of children referred, then the percentage of children who are screened, that percentage that goes on to evaluation, and the percent that are evaluated that are found eligible and continue to the program. So one way of looking at that is percentages. Another way to look at it is how many children who are referred receive services and transition to preschool special education programs. So states would have data that this is using numbers instead of percentages, but you may have over 6,000 children who are referred to the program. Of those, 3,500 move on to a screening, then to evaluation, then to enrollment. Of the 1,364 children who enter the Part C program, as they exit, they transition to the preschool special education program. So you see that close to 1,296 children are then leave the Part C program and enter the Part B special ed program. So the data tells you a different story depending on how you look at it and when you collect it. And this is just looking at data that is required to be submitted on a yearly basis, looking at the indicator data that Part C has. And I'm going to turn it over to Jackie now. She is from North Dakota, and she's going to talk about her real life experience with this and share her story with you. And let me stop for just a second. There is a lot of background noise. I don't know if you all can hear it, but if there is a way that I guess maybe we do need to mute everybody.
We don't hear it.
Oh, you don't hear
it?
No. Okay. It sounds like somebody's scraping something or something. Okay. So, Jackie, I will turn it over to you, and we'll be happy to move the slides for you.
Thanks, Grace. I will give you a heads up when I need it moved forward. My name is Jackie Dusimilli. I'm the Part C coordinator for the state of North Dakota. I am very excited to be here today, and I'm also very excited because as the preschool development grant came out, the Part C program in North Dakota was lucky enough to be part of the entire process, the grant writing process, everything. So it's been a wonderful experience, and it's great to be able to share that with everyone. So in North Dakota, we have the North Dakota Office of Early Learning. It's made up of entities from the Department of Public Instruction, so that's where our Part B 619 is housed. our Head Start Co-op administrator, and the director and assistant director of DPI's OEL, Office of Early Learning. And then there are also entities from the Department of Human Services, so that's where I'm housed for the Part C program, and then our child care administrator is there as well. And so as we wrote the preschool development grant, the Office of Early Learning really was the main grant team. And so it was, like I said, it was just a wonderful experience to be able to be that involved and really be able to help make decisions. You can go to the next slide. So as we were writing, I was able to contribute information about needs of the Part C program. So one of the things that Grace had mentioned was the state systemic improvement plan, and that actually factored heavily in our grant writing process. So when it came time to determine what was needed for Part C to be able to make some steps forward, that's really where we leaned to be able to support the needs that I was coming up with. I should say one of the interesting things about it was I started in my position about a year ago, which was about the time that we started writing the grant. And so I leaned heavily on it because I had ideas of what I thought the program needed. But the SSIP was really the document that helped support all of those things that the field was saying they needed and that really we had ideas about for Part C. Part of my role is I'm a little wordy, sorry, Grace.
No, go ahead.
Part of my role is on the writing committee was to be able to direct specific grant activities related to Part C. So based off of the SSIP, I was able to identify that we needed some professional development, and we were able to write that opportunity as well as some sustainability with it into the PDG. And then we also worked together as an overall team to be able to figure out what were the goals of the Office of Early Learning in North Dakota, and how did all of that fit together. And a lot of what we discovered when we did that was really that we didn't know quite yet what that roadmap was, but that's where that needs assessment comes in. And currently I am working with the Office of Early Learning and the rest of the PDG team to be able to work towards those goals that we wrote into the grant. Now you can go to the next slide. So as we started our needs assessment, one of the interesting things is we weren't able to start until July. So we've been going for almost 2 months now. And so we might be a little bit behind other states in terms of our needs assessment. But our contractors were requesting data for Part C. And really what we used were those 618 tables or the child count tables that Grace mentioned. So they requested demographic data. They wanted to know by race and ethnicity. They wanted to know by age what the Part C population looked like. What we found was that we looked at some of the other Part C data. We looked specifically at family outcomes, and really we just weren't at a stage where we were able to integrate that into the needs assessment yet. Our data systems, because we're housed in different departments, we don't have a data system that communicates at this point. That's one of our goals. But so being able to link and kind of compare, like Grace had showed, from referral to Part C to eligibility to transition to Part B, that's not data that we have yet. So that's coming out in that needs assessment as something that we are going to need. So because they weren't able to use a lot of that data, what we did offer up was for them to get feedback from our ICC. So the ICC is the Interagency Coordinating Council. It's required under IDEA Part C. So our contractors came to an ICC meeting, and they spoke with the members and asked, what information are we missing? Where do they think that information can be found? And who else do they need to talk to? And I think it was probably 6 or 7 of those giant sticky pad pages were full of different ideas and different entities and programs, both state and private programs that would have additional data about Part C and specifically birth to 3. They also are seeking feedback from parents who have early intervention or kids in early intervention. They are working on some transition focus groups and also some surveys, really looking at, because we don't have data to be able to support transition, getting some of that qualitative data about the transition from Part C to Part B. And then they're also doing childcare focus groups, which I know aren't directly related to Part C, but a lot of our early intervention kiddos are going to be in childcare as well. So they came to the initial ICC meeting, and they are planning on coming back in September. Their focus during that time is to follow up with the information they found, just fill in any gaps with that data, and then they've also requested to speak directly to our Part C parents who sit on the ICC and do a specific focus group with those parents. Some of those parents are current early intervention parents. Some have children who are just aging out of their eligibility, so they're 14 years old, and that parent will no longer be able to be on the ICC. So we've got a wide range of stakeholders there. Another of our next steps here is working on that ECIDS, the integrated data system. So being able to pull together birth to 3 state programs, EDI, the early hearing detection intervention, other home visiting programs that we have, healthy families, childcare data, anything that we're able to pull into that system so we can start to really track and compare those kids that come into early intervention and how they move through our system into Part B and into the school system from there. So, of course, like everyone else who's involved, we're kind of prepping for that next grant cycle. We've already started discussing a little bit about the other partners that we're going to pull in, but I know that Part C will remain involved with writing, with building off of those current goals and really being able to pull in more data to support current goals and program needs. We have talked a bit about, with a little bit longer time frame, being able to use some of that IDEA Part C data, because it's really a wealth of information that we haven't yet been able to tap into, but hopefully we'll be able to explore as we go forward. And I think that's all my slides.
Wow, thanks, Jackie. So before we begin to talk about the Part B 619 data, which covers children 3 to 5 in preschool, we have a couple minutes for any questions that people may have right now. We are going to talk more about the Part C data as we go through the presentation, but we can stop here for just a minute and see if there are any questions or anything in the chat box.
There's nothing in the chat box except for whether they heard noise or background noise or not. But we can definitely open it up now so that if anybody has a question so far, to either write it in the chat or to unmute yourself and ask your question.
Or we may have someone on the phone who has another example of using the birth to 3 data in their needs assessment. Okay, so we will go from here and we'll begin to talk about the preschool data, which is Part B 619.
Okay. Ginger, you want to, Ginger, Elliott, Teague, and I are going to do this section. This is Heidi Bernstein. Hi, Ginger. So on the preschool side, we also collect a number of indicators. And so one of the things that we do collect are the percent of children ages 3 through 5 and where they're being served. So are they in a regular education, early childhood education program, and this is both of them receiving the majority of their special education services in that program. So the kids that get pulled out and are not, for their services, are not counted here, but they have to be in the setting and served in that setting, or are they in a separate education, special education class, a separate school, or a residential facility? So that's the settings. And then we also have child outcomes, which we also collect, and this is parallel to the Part C side, where you're looking at positive emotional skills, acquisition of use of knowledge and skills, and appropriate behavior to meet the needs. And Ginger, do you want to add anything here about how you're using any of these sets of data?
Sure. So I'm in Oklahoma, and we fortunately do have a data system that communicates between Part C and Part B. So we can use data from our Part C participation and link it to settings, to outcomes, to participation, even just in special ed, and determine how those sets of data overlap between Part C and Part B. We haven't done a lot of that yet. We've only had a linked system for a couple of years, but we do expect that the linkage between the systems will be really valuable once we do that. One thing we found by looking at some of our data related to the needs assessment is that we have a lot of questions that we want to be able to answer, but that we can't yet because we don't have the data for that. So as you're thinking through these, be sure to think about what, and this was part of the North Dakota example, what else do we want to know that we need to start finding a way to collect?
Great. And I see in the chat box also that we have a question: were your data systems linked prior to your PDG work? And then
yes, they were. They've been linked for about 2 years now.
Okay. And then somebody else answered from another state saying that they were not linked, and that's one of their goals moving forward. So we see that states are in different places. And then, yeah, so that was that question. Okay, we can go to the next slide. So some of the other data that also gets collected is transition to preschool. So this looks at the percent of children referred by Part C prior to age 3 who were found eligible for Part B and have an IEP developed and implemented by Part B by their 3rd birthday. So these are the kids who we know are going forward into Part B. And transition can happen anywhere from 90 days to 9 months prior to turning age 3. We also look at parent involvement, and there's a survey that collects information on the percent of parents with a child with disabilities, ages 3 to 5, who report that the school facilitated parent involvement. So it's very much parent involvement. So how involved do the parents feel within the services that they're receiving? And that involvement is to show their ability or their ways that they are able then to help their child move forward. So Ginger, do you have something you want to add in this section?
Yeah, so this data could be used to answer questions like, if you have extensive data, like where are our Part C kiddos going? Which ones are most likely to receive services through IEPs at districts? Which ones are more likely to receive private services? So if you're able to collect additional data through your needs assessment, those would be some of those questions that you might want to consider. If you only have the public school information for preschool, you can answer some of those to determine which kiddos are more likely to attend a public school, but we know lots of kids attend private preschool also, who may also receive public services. But those would be some things. With parent involvement, that's an interesting one that you may want to think about as part of the needs assessment, whether there are trends or patterns in which families are more likely to be satisfied than others. So not just at the district level, but statewide. Are there things that you can see in your data that could help you address program quality at a broader level?
Mm-hmm. And there are several different assessment tools out there for the parent involvement surveys that are out there. Okay, the next slide. So we also, similar to Part C, we look at child count, but this time for age 3 to 5. And also the percentage of children served age 3 to 5 at the state and the national level by race, ethnicity, and by race and educational settings. Ginger, you want anything there to add?
No, just that knowing those percentages of children served can really, you can link that to program characteristics that can provide you really valuable information about services by race or setting.
Mm-hmm. Okay, thank you. Next slide. So some of the questions that you might want to ask that are also a little bit stretching the data would be how many children transition directly or indirectly from EI, from the Part C program, to preschool special education, from the EI to the 619 program, and how many children have not received EI services but enter preschool special education. So if you look at the next slide, I created a hypothetical graph that would look at it. So on the first side, on the first bar graph, you see those 250 kids, they transitioned directly from early intervention into early childhood special education. And then you had, in the green, 375 kids who did not transition directly. So they may have been, they were in EI, they were out of EI maybe at age 3 because there was no program that they were in, or they didn't, the parents felt they didn't need services. But then at age 4, or they came back in. So that's that group. So they had received services, were not receiving services, and came back in. And then the 800 that you see on the second bar graph would be kids that were never in early intervention and then were found eligible during the preschool years. So that's just kind of one way to slice and look at your data that could be interesting. Do you have any questions on anything that we've done in this section?
This is Grace. Oh, and this is Grace while you're looking at that question. So as you can see, when you think about the IDEA data that we have through Part C and Part B 619, which would be children birth to 5, that we're able to look at what is referred to as child count, which is the number of children served in a year. And states may have two different counts there. They may have the data that they turn in required through the APR, which is a point in time, but they may also have the data on the total number of children served throughout the year, which is a different number. You can also see that we have data related to child and family outcomes. So how are children doing in meeting their basic needs, having the social emotional skills to interact in everyday activities, and have the knowledge and skills, the continual development that they need. We also have data related to family or parent involvement. So there's data collected that lets us know how do families understand how they can help their child develop and learn. Are the programs that we're offering helpful to them in that goal? We also have 2 resources that we'll share at the end of this. One is what we call the critical questions, which are what are those critical questions that we need data to answer. And as our presenters have shown, there is data that we know that we have, and there's data that we would like to have. And the PDG process has certainly helped bring that to light across the broad spectrum of serving all young children birth to 5. So just to sort of summarize, that's the type of data that is submitted for reports, for the federal reports, but there's also a wealth of data that both programs have, which there's been some mention of. Okay, we have a question.
So Jim has written into the attendees asking that he's curious how the link that is already in place here and happened, and what was the impetus for this, and how did it come about? So the people who have already linked their systems, if you want to write into your chat or open up and give a little information to others about how you came about linking some of your data.
And just to note, after we talk about the state systemic improvement plan, Deborah Anderson will talk about and give an example of linking data as well. So we'll stop for a second, and for those of you who have done some linking, if you don't mind putting that in the chat, that would be great.
So this is Ginger. We do have a linked Part C and Part B data system, and our Part C system contains all IFSP information statewide. Our Part B system contains all IEP information statewide, and we can transfer students from Part C to Part B within the same system. We decided to link them because we wanted to have better transition information and better transition services between C and B. So I could go on for an hour on how this happened and why it happened, but if you have questions about that process, feel free to contact me outside the presentation. I'd be glad to talk to you about that.
Thanks, Ginger. So do we have some other examples as well? Okay. Do you see anything, Heidi?
No, I think you can go ahead.
Okay. All right. So another piece of information we'd like to share with you, and some of this may look familiar, and you've certainly heard both Jackie and Ginger mention this. In 2015, states were required to develop what we refer to as the SSIP. So you may have heard that term. So it's the State Systemic Improvement Plan. And the states were asked to develop a multi-year plan to improve results on two levels. So improving results for infants and toddlers with disabilities and their families, the child outcomes, and improve results for children ages 3 to 21 with disabilities. So states were focused either or both on improving child and family outcomes. So the first year, and this is where I think Jackie mentioned, and this data may be helpful to you in your needs assessment, states were asked to conduct a data analysis on what were the needs of children with disabilities and their families in their state. Identify what infrastructure was in place to support that and what would need to be done to build capacity. They were asked to identify what you may hear referred to as a SIMR, which was what is the measurable result that we hope to achieve through this plan and the implementation of the plan. Identify improvement strategies and a theory of action. So this may sound familiar to those of you who are working on your needs assessment and looking at the PDG work. In phase 2, they were asked, states developed an infrastructure needed to support their improvement strategies. So what were the personnel needs? What are the data needs? What are the quality assurance that we would have in place? What is that infrastructure that we needed to have in place in order to support the improvement strategies? Throughout the system, everybody would be involved in this, but strengthening the infrastructure was to put in place evidence-based practices at the local level. And then they were asked to conduct evaluations of progress. So they developed a 5-year plan based on data and a needs assessment to identify what the needs were. They chose a child and or family outcome to focus on, and then identified what evidence-based practices they would have in place to move towards that measurable result that they were focused on. They have been working on those plans through now, and it will continue. And the important piece of this is that through this process, states have begun to collect not only the required data, but additional data, as you've heard shared, that would be quite useful. They've been asked to use implementation science and improvement science through their efforts. And so within the Part C and 619 programs, you would have staff who are very familiar with a similar process that the PDG is asking that states look at now. They would also have data and some analysis of their infrastructure that could inform the needs assessment around serving children with disabilities. So there's a wealth of information that's there and continues to grow. I think when Ginger gave the example of linking Part B and Part C data, while that occurred prior to the PDG work, in the work that we're doing with states now, there is a lot of conversation. I think the SSIP process has brought to light the need to better link data, not only between B and C, but within the broader early care and education field because of the breadth of information it gives us and the need to evaluate the difference that we're making with the work that we do. So one thing you, in a little bit, we'll show you some websites where this data and information is stored, but this is, as Jackie mentioned, there's a 5-year plan in place that might be quite helpful to the needs assessment process. So there's some information on that. I'm going to turn it over now to Deborah Anderson, who is a PDG grant manager in Oklahoma, and she is going to share a example of how they linked 2 sets of data and the information that has given them in making improvements.
Hi, good afternoon. Thank you so much for this opportunity. I have to say that I am a former Part C provider. Back in the day when Oklahoma first implemented our Student Start program. So obviously this is an area that will always stay very close to my heart as I move through our work. Briefly, I wanted to just describe that I am the Executive Director of the Oklahoma Partnership for School Readiness. And through our organization, we are charged in state statute with convening and coordinating and improving collaboration among all early childhood programs and services that are in the state. So we staff a 32-member board that's represented by 15 child-serving state agencies. So we have the opportunity to bring those partners together on a regular basis to talk about how we can improve our system of services. So we were thrilled to be named as the lead in Oklahoma. We see ourselves as more of a neutral body in being able to coordinate efforts across all state agencies. And at our heart is the desire that kids and families have improved outcome. We're not a direct service provider, but focused on systems work. And so for, my story about how Sooner Start, Part C in Oklahoma, became the first step in linking data is that this has truly been about a 10-year journey of a lot of conversations and a lot of hopes and wishes and desires. And we've dreamed big. We've thought about all the wonderful things that could potentially provide to us in making better decisions about how we serve kids and families and how we direct our investments and how we're ensuring that we get good outcomes. But in order to make something happen, we had to focus on one identifiable action, and I'll talk a bit about how we got there. So the first thing that we've been doing over the past several years is linking to existing efforts in the state. So even broader then thinking about our Part C and Part B data, or our child care Head Start data, pre-K information. We looked at what else is going on in the state to develop data linkages, because we realized that we probably would never have all the funds to make a separate system possible. And we also realized that by joining together with the broader partners, that we could make a stronger system through that collaboration. There was a group that existed for a while that was called Discuss, and they are an interagency body about state agencies, 8 state agencies that were under the former Health and Human Services Cabinet. We've reorganized a bit in state government, have been meeting for several years, thinking about how to create a interoperability within data systems. And the impetus was really focused on health exchange information, so how they could link health data. And there was some funding that was available through the federal government related to health data, that they were using that to help support some of their work. Under that group, they implemented a unique identifier. What we're using in Oklahoma is called the Master Person Index. That is an analytical tool. And I'll get a little bit out of my pay grade if I talk too deep into the data processes of this, but that's developed by Oracle. So Oklahoma is contracting with them to assign a unique identifier to quite a few different records across health, human services, agencies in the state. We received some private funding. We had 2 private funders, the Dedicated Kellogg Foundation and in-state with the George Kaiser Family Foundation, who were interested in supporting state efforts to integrate data as well. So we had some funds to really put people power into the work and keep the groups together, talking, convening. We found that it's nobody's job to talk about how to integrate data across agencies. And so by using this private funding, it helped us staff and support a group of individuals to meet. I will say that when we began, we had a lot of program staff that were dreaming about integrated data and what they would like from the system. Towards the end, we found it was important to bring in data managers to talk about what specifically needed to happen to link the data. And then we also have had to figure out how to communicate between the two of helping data managers see the vision and mission of what we wanted to do with an ECIDS system in the state. And then finally, Project Shine, and you can go on to the next slide, provided us a specific opportunity in order to be able to link data specifically around home visiting programs. And so through that process, we identified some research questions, and we certainly were interested in enrollment of children in home visiting programs and how that might impact their later outcomes. And then we also wanted to know which children were enrolled in programs in addition to home visiting. So what was an unduplicated count of children being served, and then how was participation connected to later outcomes? And so we had several research questions, but we were working closely with our the data managers with our home visiting program through the Department of Health. And they said, you know, it would be really one easy link that would give us some good information that would help address one of our benchmark reporting measures, is to understand, do children who are enrolled in home visiting programs who are referred to Sooner Start receive an assessment within 45 days of their referral? So they had a benchmark that they wanted to ensure that the families being served through home visiting, that those children got their assessment within 45 days. And they said, hey, we could link our data sets and answer that question. So if you want to go to the next slide. So in designing how we were going to make this happen, we had some opportunities and we had some challenges. The master person index had been completed on both of these sets of data already. So that, that kind of sped up the process of, we had the mechanism available to know how we were going to be able to link the data. The Department of Education is the lead agency for Sooner Start, but the services are administered, the service providers are administered through the Department of Health. So that data also resides in a health department data set, along with our home visiting services, our MCV or MCHIF, or however you say that in your state. So our home visiting services are also in the health department. So that let the data managers within the same agency create and manage those data linkages. And I think that that was important to understand, that they were able to work together on that internally, even though they were two separate data systems housed in those agencies. And the next bullet says, you know, their data systems don't automatically link. Because the Department of Education is the lead agency for both Part C and Part B, we had to get legal counsel from two agencies to agree and approve this data linkage. And for any of you who have been working with getting legal on board as well, to ensure that we have addressed everything that needs to be addressed as we begin to share and link data, that can sometimes be another hurdle that you have to work through. But having a very specific question and having an administrative reporting need seem to have made that approval process quicker. So we found that it was very, very helpful, again, to have this one identifiable action to say to legal counsel, here's why we want to link this data. And then it seemed like a streamlined path to be able to get the data sharing agreement. Next slide. And so quickly, SHINE is state level home visiting integration with early childhood data. We were one of 5 states to be a SHINE state. We learned a lot about data integration from our other states. We've learned things that we didn't have and what we had. Our objective on that was to create a schedule so that we could have that data sharing agreement to link data. So that refers to what we were able to accomplish with the legal counsel between both agencies. Next slide. So we, once all the approvals happened, and I would say this was from the time that we identified this would be a great set of data to link, and we went through the processes of getting the approval. I'm going to say that was probably less than a 6-month process, which sounds kind of long, but it actually was not too bad in the grand scheme of things that we've tried to do in years past. And it also has set the stage and created the opportunity that we can build on what we've done with this. But we found between both sets of data, there were 163 records that matched. So there were 163 children that had been assessed by Sooner Start and receiving home visiting programs. Curiously, 35 of the referrals from home visiting found that they did receive an initial assessment from Sooner Start within the 45-day timeline, which our Sooner Start program is amazing in Oklahoma, so we didn't doubt that that might not be happening, but it was great to be able to take the data and put it together and verify that. And then there were 118 children who were enrolled in home visiting programs that had received an initial assessment prior to the home visitor referring the child to for an additional assessment. So that gave some data about there were children being identified by the home visiting program that had already received an assessment from Part C. So that's some valuable case management information that can be used to think about how we coordinate and think about referrals. According to the data managers, the ability to match these records increased the accuracy of the data. They didn't feel like the data that they were receiving self-reported from the home visitors were as accurate as what they were able to get when they linked it And then it also reduces the burden for providers to have to remember to enter the data so that they can focus on service provision. So just those two benefits have been very powerful as we talk to leaders in our state on benefits of linking data, how it addressed these two really important issues of reducing some burden on those providing services and having more accurate data. Next slide. So we are currently, with our preschool development grant, developing a technical assistance, we're getting a technical assistance plan for increasing our ability to link data across agencies. One of the things that we felt we were severely lacking in was a strong governance structure. And that was one of the things we learned through Project Shine. Some states have some really great governance in place, and we need to more clearly identify when we link data, how do we adequately ensure who has access to that data and the privacy and protection that goes along with governance. And then we're also building some data integration, data element inventories. What are some key questions that we want to know? So to know those, what are the data elements that we're going to have to gather to understand that? And then finally, how might we integrate our system? So we have a contractor that's been working with Oklahoma on those processes. And each of the agencies have added additional questions that of information that they want to know. And from the Department of Education particularly, they had a request that we look a little bit deeper into both our Part B and Part C services. So each agency put one or two priorities on the table in use cases of what we want to better understand in our state. And I'm really happy that the Department of Education prioritized understanding more about eligibility. What are the factors that drive the number of children of referrals, Sooner Start referrals that don't lead to service? So we know that we have a lot of children that are being referred for assessment and they're not found to be eligible. So how do we ensure that the system wraps around potential need or integration of making sure that families are aware of other early childhood care and education services that they might be eligible for? So combination of where are we able to serve kids, and are there gaps in populations? And then what happens with children that aren't eligible, and ensuring that they have a continuity of care.
Great.
Any questions?
So we have 3 great examples, and we were hoping that these examples would also prompt those of you who have joined us to be able to share some examples of what you're doing or questions you might have about accessing the Part B and Part C data for your needs assessment. So if you want to unmute and share what work you're doing within your state, or if you want to put something in the chat box, this would be a great time. Because I know with over 100 people, surely someone else on the phone has done some work around some of these very same things that we've shared today. So Heidi, do we have anybody in the chat?
At the moment, we do not.
We do not. Okay.
But I will second the motion and encourage everybody to share. I mean, because I've looked at the list here. I know we've got some really great people out there.
We do. So while you guys are thinking about that and putting your thoughts to order, so you can put them in the chat or you're unmuting to share how you're working together in your state. We have developed some resources. We have a one-page, a one-pager that has the links to all of the data that we've talked about today, so that you can quickly find the data related to your state. We will be sending that out. Another resource that we have that I've heard mentioned on another PDG webinar about data is the critical questions document, which looks at what are those critical questions you might be asking about serving young children with disabilities in your state, and where and how you might look at that data. So we will be sharing those resources with you as well. So do any of our presenters want to add or ask questions of what they've heard today of the other presentations? Jackie, I think your example that you gave of being able to look at your state systemic improvement plan, the SSIP, and using that as the strategies from that and the data analysis of that to inform the PDG work is a great way to use that work that's been done. There was a lot of thought and stakeholder engagement and data analysis in that process. So I think that was a great use of the SSIP.
I really got to ride on the coattails of the previous Part C coordinator as well, because she did all the work. I just got to use it as a roadmap.
You just get to use it, yeah.
That's right.
And Deborah, I think the example that you gave of looking at the home visiting data and the Part C data, and not only, so what we should be thinking about is not only what does the data tell us about the children and families we're serving, but what it might tell us about our systems and how we can better improve our programs and systems as well.
Yes, absolutely. I'm also putting in the chat box the Early Childhood Data Collaborative. Many of you may be familiar with that, but we have participated in that survey for a few years. We've really found that in our state, we're doing a better job of linking data within agencies than we were in the past. So where multiple programs are housed in one agency, that certainly helps. But we know we still have a lot of work to do, but that provides really great guidance on thinking about factors related to linking data as well.
Thanks. Okay, do we have any examples? I'm not able to see the chat, or do we have anybody that would like to add to what we've shared today?
I do not see any more examples in the chat.
Okay. However, we know there are lots of examples out there from the work that we're doing with states. So, all right. So I do want to really thank our partners, ECTA, DAISY, and PDG, Birth to 5, the TA Center. Also thank our state presenters with Jackie and Ginger and Deborah. Thank you for sharing. I hope that this will be informative. On the slides, we have links to data and information that might be very helpful to you. We also have links so that you may contact us to follow up if you have additional questions. So without any further questions or anyone that wants to share, we will go ahead and wrap up, and I hope that you have a good rest of your week.
So you will, and reminder that you will all get an evaluation at the end of this, and we encourage everybody to fill it out. It's always useful to hear the feedback, and we're going to give you back a little bit of your time.
Yeah.
So.
All right. Have a good week, everybody.
Thank you so much.